football does not only lead to pain in the knees or joint pains, but it also leads to nasal deviation through broken noses. As a surgeon that has performed multiple cases on football stars, how do you go about fixing broken noses?
Well, as you know, the football players are highly exposed for a facial trauma. And very often we get patients from the football teams with broken noses, deviated noses. Usually when the nose is broken or deviated fresh, I mean, it's usually fixed between day 5 and day 10 usually. So first of all, when the footballer comes to me and say I have an injury, usually come 1 day or 2 days after the injury, we examine the nose, we do some x-ray, but we do not do anything until after day 5. Because we need to wait for the edema to subside, because sometimes even the nose is broken but the nose is still straight. If even there is a fracture on the x-ray but the nose is straight, we do nothing.
Okay.
But after 5-7 days, when the التورم
like the swelling subsides?
when the swelling subsides,
okay.
Then if the deviation becomes obvious, then we admit the patient to the hospital and we give very mild sedation and we reduce the fracture and make the nose straight and symmetrical. Also sometimes they have deviated nasal septum, also we fix the deviation of the nasal septum. So we fix both the nose from externally and internally. Okay, but many, for example, footballers which I operated on, they ignore the trauma and they come to see me after 6 months or 8 months or even 1 year. In this case, we have to do a full nose reshaping. We have to do a full septal rhinoplasty. We have, for example, we have done more than 12 famous footballers in this country and in Saudi Arabia. We have, for example, can show now an example 2, which will allow us to show the photographs, how they had deviated nose, and we did full septal rhinoplasty in order to obtain more straight, more symmetrical nose, and also more patent airways.
I believe one of the footballers was looking for you, and you were actually practicing in London, and he took the next flight to you in London just to have his procedure with you.
That's right. Abdul Salam, he plays in the national team, a very, very nice guy. And actually on that week, when he had his injury, I was operating in London at the Welbeck Hospital, and he followed me to London to the Welbeck Hospital, and we did fix his nose in London at the Welbeck Hospital, which is just only off Harley Street, yes.
Right, so post fixing the broken nose, is the nose weaker than previously? Are they more prone to more fractures?
The nose usually weaker only the first 6 weeks. After 6 weeks or 2 months, the nose will become strong as it was before.
All right, great.
Yeah.
All right, Dr. Bashar, thank you so much for showcasing a few of your successful rhinoplasty surgeries.
Thank you, my pleasure. Thank you.